Before you skip this live stream, have you ever had fever, chills, headache, and body weakness, and immediately called it malaria? Today, we're breaking down malaria in simple question and answer form so you can actually understand what is happening inside the body. No confusion, no long talk, just real answers to real questions people ask every day. Stay with me till the end. 1. What is malaria in the human body? Answer. Malaria is a disease caused by parasites called Plasmodium that enter the body through a mosquito bite. The parasites first go to the liver where they multiply. Then they move into the bloodstream and enter red blood cells. Inside the red blood cells, they continue to multiply and eventually destroy the cells, which leads to symptoms like fever, weakness, and body pain. 2. Why does malaria cause fever? Answer. Malaria causes fever because a parasite destroys red blood cells in cycles. When the infected cells burst, they release parasites and waste materials into the blood. The immune system reacts strongly to this process by raising body temperature, which results in fever, chills, and sweating episodes. 3. Can malaria kill a person if not treated? Answer. Yes. Malaria can become fatal if not treated, especially in severe cases. It can lead to complications such as severe anemia from destruction of red blood cells, brain infection known as cerebral malaria, organ failure affecting the kidneys and liver, and in extreme cases, coma or death, particularly in children and pregnant women. 4. Why does every mosquito bite not cause malaria? Answer. Not every mosquito bite causes malaria because only infected female Anopheles mosquitoes can transmit the parasite. The mosquito must first bite an infected person, allow the parasite to develop inside its body, and then transmit it to another person during a later bite. 5. Can malaria be spread from person to person? Answer. No. Malaria is not spread directly from person to person. It does not spread through touching, kissing, coughing, sharing food, or close contact. It is only transmitted through the bite of an infected mosquito carrying the malaria parasite. 6. Can malaria come from dirty water or food? Answer. No. Malaria does not come from dirty water or contaminated food. It is strictly a mosquito-borne disease. However, stagnant water can increase mosquito breeding, which indirectly increases the risk of malaria infection. 7. Why do malaria symptoms come in cycles? Answer. Malaria symptoms come in cycles because the parasite grows inside red blood cells and bursts them at intervals. Each time the cells rupture, a wave of parasites enters the bloodstream, causing repeated episodes of fever, chills, and sweating. 8. Why do some people recover faster from malaria? Answer. Some people recover faster due to differences in immunity, early treatment, age, overall health condition, and nutritional status. People with stronger immune systems or those who start treatment early tend to recover more quickly than others. 9. Can a person have malaria without knowing? Answer. Yes. A person can have malaria without obvious symptoms, especially in the early stage or in people with partial immunity. In such cases, symptoms may be mild, such as slight headache, fatigue, or weakness, without strong fever or obvious illness. 10. Why does malaria cause body weakness? Answer. Malaria causes body weakness because it destroys red blood cells, reducing oxygen supply to tissues and organs. This leads to fatigue, dizziness, reduced strength, and difficulty performing normal physical activities, especially when the infection becomes severe. 11. Why do malaria symptoms take days before showing? Answer. Malaria symptoms take time because after entering the body through a mosquito bite, the parasite first travels to the liver where it multiplies silently. Only after leaving the liver and entering the bloodstream does it start destroying red blood cells, which is when symptoms like fever and weakness begin to appear. 12. Why does malaria make someone feel cold before fever? Answer. Malaria makes the body feel cold first because the immune system triggers a response that rapidly increases internal body temperature. During this early phase, the body tries to generate heat quickly, which causes shivering and cold sensations even though the temperature is rising. 13. Can malaria affect the brain? Answer. Yes. Severe malaria can affect the brain when infected red blood cells block small blood vessels. This condition is called cerebral malaria and can lead to confusion, severe headache, seizures, loss of consciousness, or coma, if not treated quickly. 14. Why do children suffer more from malaria? Answer. Children suffer more because their immune system is not fully developed to fight malaria parasites effectively. They also lose red blood cells faster during infection, making them more vulnerable to severe anemia, high fever, and complications. 15. Can malaria cause anemia? Answer. Yes, malaria causes anemia because the parasite destroys red blood cells during its life cycle. When too many red blood cells are destroyed faster than the body can replace them, the blood becomes low in hemoglobin, leading to weakness and pale skin. 16. Why do malaria drugs sometimes fail to work immediately? Answer. Malaria drugs may take time to work because they need to kill parasites at different stages of their life cycle. Also, the body needs time to recover from damage already caused by destroyed red blood cells, so symptoms may continue briefly, even after treatment starts. 17. Can malaria return after full recovery? Answer. Yes. Malaria can return either through a new mosquito bite or if some parasite stages remain hidden in the liver and later become active again. This is why prevention and avoiding mosquito bites remain important even after recovery. 18. Why do people sweat heavily after malaria fever? Answer. Heavy sweating happens because the body is trying to reduce its high temperature after the fever phase. Once the immune system lowers the fever response, the body releases excess heat through sweating to restore normal temperature. 19. Can someone have malaria without fever at all? Answer. Yes. In some cases, especially in adults or people with partial immunity, malaria may present without strong fever. Instead, symptoms like tiredness, mild headache, loss of appetite, or body weakness may be more noticeable. 20. Why does malaria make someone lose appetite? Answer. Malaria affects appetite because the infection triggers inflammation in the body, which changes how the brain regulates hunger. At the same time, weakness, nausea, and fever make eating uncomfortable, leading to reduced food intake. 21. Can malaria be treated at home without hospital? Answer. Malaria can sometimes be treated at home using prescribed anti-malarial drugs, but only after proper diagnosis. However, severe cases should never be treated at home because complications like severe anemia or organ damage require hospital care and close monitoring. 22. Why do malaria symptoms get worse at night? Answer. Malaria symptoms often feel worse at night because body temperature naturally fluctuates during sleep, and the parasite's activity in red blood cells can trigger stronger fever cycles, chills, and sweating during rest periods. 23. Can malaria affect pregnancy? Answer. Yes. Malaria can seriously affect pregnancy by causing anemia in the mother, low birth weight in the baby, premature delivery, or miscarriage in severe cases. Pregnant women are more vulnerable because their immune system is naturally lowered during pregnancy. 24. Why do malaria patients feel dizzy? Answer. Dizziness happens because malaria reduces the number of healthy red blood cells, which lowers oxygen supply to the brain. This oxygen shortage leads to lightheadedness, weakness, and sometimes fainting. 25. Can malaria cause headache only without other symptoms? Answer. Yes. In early stages, malaria may present mainly as headache before other symptoms like fever, chills, or body pain appear. This is why early testing is important when persistent headache occurs in high-risk areas. 26. Why does malaria make the body feel hot internally? Answer. The internal heat comes from the immune system reacting to malaria parasites. When infected red blood cells burst, the body releases chemicals that trigger inflammation. Increasing internal temperature, even before external fever, is fully noticed. 27. Can malaria cause vomiting? Answer. Yes. Malaria can cause vomiting because the infection affects the digestive system and triggers strong immune reactions in the body. Fever and weakness can also make the stomach sensitive, leading to nausea and vomiting. 28. Why do malaria patients lose strength in the legs? Answer. Leg weakness happens because malaria reduces oxygen supply to muscles due to destruction of red blood cells. Without enough oxygen and energy, the muscles become tired quickly, making walking or standing difficult. 29. Can malaria be detected through blood test only? Answer. Yes. Malaria is confirmed mainly through blood tests. A microscope test or rapid diagnostic test is used to detect the presence of malaria parasites in the blood, which is the most reliable way to diagnose it. 30. Why does malaria make someone sleep a lot? Answer. Malaria causes excessive sleepiness because the body is using a lot of energy to fight infection while also suffering from reduced oxygen supply. This combination leads to fatigue and increased need for rest. 31. Can malaria cause chest pain? Answer. In some cases, malaria can cause chest discomfort due to severe fever, dehydration, or anemia, reducing oxygen delivery. However, chest pain should always be checked carefully because it may indicate a more serious condition. 32. Why do malaria symptoms come back after feeling better? Answer. Symptoms may return if not all parasites were fully cleared from the body, or if a new infection occurs from another mosquito bite. Sometimes incomplete treatment can also allow parasites to multiply again. 33. Can malaria affect the liver? Answer. Yes. Malaria can affect the liver during its early stage when parasites multiply there before entering the bloodstream. In severe cases, it can cause liver enlargement or dysfunction due to infection stress. 34. Why does malaria make someone sweat at night? Answer. Night sweating happens when the fever breaks, as the body temperature drops after a fever spike. Excess heat is released through sweat, often making patients wake up drenched. 35. Can malaria cause loss of concentration? Answer. Yes. Malaria can reduce concentration because the brain receives less oxygen due to destroyed red blood cells. Fever and fatigue also affect mental clarity and focus. 36. Why do malaria patients feel cold, even in hot weather? Answer. This happens during the chills phase of malaria. The body is trying to raise its temperature rapidly, so it triggers shivering and a cold sensation, even when the environment is hot. 37. Can malaria affect appetite for several days? Answer. Yes. Malaria can suppress appetite for several days due to ongoing fever, weakness, nausea, and the body's inflammatory response, which affects hunger signals in the brain. 38. Why do malaria patients look pale? Answer. Paleness occurs because malaria destroys red blood cells, reducing hemoglobin levels in the blood. Hemoglobin gives blood its red color, so low levels make the skin and eyes appear pale. 39. Can malaria cause body pain all over? Answer. Yes. Malaria can cause widespread body pain due to inflammation in the body and the immune system's response to infection. Muscles and joints often feel sore and heavy. 40. Why is malaria more common during rainy season? Answer. Malaria is more common during the rainy season because stagnant water from rain creates ideal breeding sites for mosquitoes. More mosquitoes increase the chances of transmission. 41. Can malaria affect the heart? Answer. Malaria does not directly attack the heart in most cases, but severe malaria can strain the heart because of anemia, fever, and low oxygen levels in the blood. This can make the heart beat faster than normal to compensate for reduced oxygen supply. 42. Why do malaria patients feel tired even after sleeping? Answer. This happens because malaria destroys red blood cells, reducing oxygen supply to the body. Even after sleep, the body is still recovering from infection, so fatigue remains until the parasite is fully cleared and blood levels improve. 43. Can malaria cause back pain? Answer. Yes. Malaria can cause back pain due to muscle inflammation, fever-related body stress, and general weakness in the muscles. The pain is usually part of overall body ache rather than a specific spinal problem. 44. Why do malaria symptoms come suddenly? Answer. Malaria symptoms may appear suddenly because the parasite multiplies silently in the liver and blood before symptoms begin. Once a large number of infected red blood cells burst at once, Symptoms start quickly and become noticeable. 45. Can malaria affect eyesight? Answer. In severe cases, malaria can affect eyesight indirectly by reducing blood supply and oxygen to the brain and eyes. It may cause blurred vision, dizziness, or temporary visual disturbances. 46. Why do malaria patients lose weight? Answer. Weight loss occurs because malaria reduces appetite, increases body energy use during fever, and causes breakdown of red blood cells. The body uses stored energy reserves, leading to visible weight loss over time. 47. Can malaria cause stomach pain? Answer. Yes. Malaria can cause stomach discomfort due to inflammation, liver involvement, and side effects like nausea and vomiting. The digestive system may become sensitive during infection. 48. Why does malaria cause sweating at the end of fever? Answer. Sweating happens when the body is trying to cool down after a fever spike. Once the immune system reduces the fever response, excess heat is released through sweat to normalize body temperature. 49. Can malaria affect children differently from adults? Answer. Yes. Children are more vulnerable because their immune system is not fully developed. They may develop higher fever, faster weakness, severe anemia, and complications more quickly than adults. 50. Why does malaria make someone feel confused? Answer. Confusion can occur in severe malaria when the brain does not receive enough oxygen due to destroyed red blood cells or blocked blood vessels. High fever can also affect brain function temporarily. 51. Can malaria cause joint pain? Answer. Yes. Malaria can cause joint pain as part of overall body inflammation. The immune system releases chemicals that cause muscle and joint discomfort during infection. 52. Why do malaria patients lose energy quickly? Answer. Energy loss happens because red blood cells, which carry oxygen and nutrients, are destroyed. Without enough oxygen, the body cannot produce energy efficiently, leading to quick exhaustion. 53. Can malaria affect sleep quality? Answer. Yes. Malaria can disrupt sleep due to fever, chills, body pain, and sweating. Patients often wake up frequently during the night because of discomfort and temperature changes. 54. Why does malaria cause shivering? Answer. Shivering happens when the body tries to raise its temperature rapidly during the early stage of fever. The muscles contract repeatedly to generate heat, causing chills and shaking. 55. Can malaria cause dehydration? Answer. Yes. Malaria can cause dehydration due to high fever, sweating, vomiting, and reduced fluid intake. This makes the body weaker and worsens symptoms if not corrected. 56. Why do malaria symptoms vary from person to person? Answer. Symptoms vary depending on immunity, age, parasite load, health condition, and how early treatment begins. Some people experience mild symptoms, while others develop severe illness. 57. Can malaria affect the immune system? Answer. Yes. Malaria challenges the immune system by constantly attacking red blood cells. The immune system becomes highly active, which can lead to inflammation and temporary weakening of overall body balance. 58. Why do malaria patients feel weak in the morning? Answer. Morning weakness happens because the body has been fighting infection throughout the night. Fever cycles and poor sleep quality contribute to fatigue upon waking. 59. Can malaria cause loss of consciousness? Answer. Yes. In severe cases, malaria can lead to loss of consciousness if the brain is affected, especially in cerebral malaria. This is a medical emergency requiring immediate treatment. 60. Why does malaria affect breathing in severe cases? Answer. Severe malaria can affect breathing because of anemia, low oxygen supply, high fever, or fluid imbalance in the body. The body tries to compensate by increasing breathing rate. 61. Can malaria cause skin changes? Answer. Yes. Malaria can cause paleness due to anemia. In some severe cases, the skin may also appear dry or weak because of dehydration and overall body stress. 62. Why do malaria symptoms worsen without treatment? Answer. Without treatment, the parasite continues multiplying in the blood, destroying more red blood cells. This leads to increasing fever, weakness, and risk of complications over time. 63. Can malaria affect kidney function? Answer. Yes. Severe malaria can affect the kidneys by reducing blood flow and causing stress on the organ. This can lead to difficulty in filtering waste from the body. 64. Why do malaria patients feel cold after sweating? Answer. After heavy sweating, the body loses heat quickly, causing a sudden drop in temperature. This can make the patient feel cold even after a fever episode. 65. Can malaria cause irritability? Answer. Yes. Malaria can cause irritability due to fever, discomfort, pain, and lack of sleep. The body is under stress, which affects mood and behavior. 66. Why does malaria affect work performance? Answer. Malaria reduces oxygen supply and energy levels in the body, making it difficult to concentrate, move, or perform physical or mental tasks efficiently. 67. Can malaria affect heartbeat? Answer. Yes. Malaria can increase heartbeat rate because the body is trying to compensate for low oxygen levels caused by destruction of red blood cells. 68. Why do malaria patients feel hot and cold at the same time? Answer. This happens during fever cycles when the body temperature is rising internally, but the outer body still feels cold due to shivering and temperature imbalance. 69. Can malaria cause long-term weakness? Answer. Yes. If malaria is severe or repeated, it can cause long-term weakness due to repeated destruction of red blood cells and prolonged recovery of the body. 70. Why is early treatment important in malaria? Answer. Early treatment is important because it stops the parasite from multiplying further in the blood. This prevents complications, reduces symptom severity, and speeds up full recovery. 71. Can malaria affect hearing or ears? Answer. Malaria does not directly damage the ears, but severe malaria can cause dizziness, weakness, and reduced oxygen supply to the brain, which may temporarily affect balance and how a person perceives sound. 72. Why do malaria patients feel sleepy all the time? Answer. Sleepiness happens because the body is using a lot of energy to fight infection while also dealing with low oxygen levels from destroyed red blood cells. This causes constant fatigue and increased need for rest. 73. Can malaria cause fast breathing? Answer. Yes. Malaria can cause fast breathing, especially in severe cases, because the body is trying to increase oxygen intake to compensate for reduced oxygen delivery caused by anemia. 74. Why does malaria make someone look weak physically? Answer. Malaria causes physical weakness due to destruction of red blood cells, dehydration, fever, and loss of appetite. All these reduce energy levels and muscle strength. 75. Can malaria affect speech or talking? Answer. In severe malaria cases, especially when the brain is affected, a person may become confused or weak, which can temporarily affect clear speech or ability to communicate properly. 76. Why do malaria symptoms feel worse in children at night? Answer. Children often experience stronger fever cycles at night due to natural body temperature changes during sleep, combined with parasite activity and weaker immune response. 77. Can malaria cause numbness? Answer. Malaria does not usually cause numbness directly, but severe cases affecting circulation and oxygen delivery may cause temporary tingling or unusual sensations in the body. 78. Why do malaria patients avoid food? Answer. Malaria reduces appetite due to fever, nausea, stomach discomfort, and overall body weakness. The brain's hunger signals are also affected during infection. 79. Can malaria cause eye redness? Answer. Yes. Malaria can sometimes cause eye redness due to fever, dehydration, or inflammation in the body, although it is not one of the main symptoms. 80. Why does malaria make someone feel like vomiting but not always vomit? Answer. This happens because malaria affects the stomach and nervous system. The body reacts to infection and fever, creating nausea, even when vomiting does not occur. 81. Can malaria cause sweating without fever? Answer: yes. Sweating can still occur as the body tries to regulate temperature during recovery phases or between fever cycles, even when temperature is not extremely high. 82. Why do malaria patients feel heavy in the body? Answer: body heaviness comes from low oxygen supply, muscle weakness, dehydration, and overall fatigue caused by destruction of red blood cells. 83. Can malaria affect mood or emotions? Answer: yes. Malaria can affect mood due to physical discomfort, lack of sleep, fever, stress, and weakness, which may lead to irritability or low mood. 84. Why do malaria symptoms appear worse at rest? Answer: symptoms may feel worse at rest because the body temperature fluctuates more noticeably when inactive, and awareness of pain or discomfort becomes stronger without distraction. 85. Can malaria cause trembling hands? Answer: yes. Trembling can occur during fever or chills phases when the body is trying to generate heat rapidly through muscle contractions. 86. Why do malaria patients feel like lying down all the time? Answer: this is due to extreme fatigue from low oxygen levels, reduced energy production, and the body's need to conserve strength while fighting infection. 87. Can malaria affect learning or thinking ability? Answer: yes. Malaria can temporarily affect concentration and thinking because fever, weakness, and reduced oxygen supply can slow brain function. 88. Why does malaria cause rapid heartbeat? Answer: the heart beats faster to compensate for reduced oxygen in the blood caused by destruction of red blood cells. This helps deliver oxygen more quickly to organs. 89. Can malaria cause fainting? Answer: yes. Fainting can occur in severe cases due to low blood pressure, dehydration, or severe anemia, reducing oxygen supply to the brain. 90. Why do malaria symptoms come back after a few days of feeling better? Answer: symptoms can return if the parasite was not fully cleared or if a new infection occurs. Some malaria types can also hide in the liver and reactivate later. 91. Can malaria affect children's growth? Answer: repeated malaria infections in children can affect growth indirectly by reducing appetite, causing anemia, and weakening overall health over time. 92. Why do malaria patients feel cold, even when covered with blankets? Answer: during chills phase, the body temperature is rising internally, but the skin feels cold because blood flow is directed inward, causing shivering even under warm covering. 93. Can malaria cause long fever days? Answer: yes. Malaria can cause prolonged fever if untreated because the parasite continues multiplying in cycles inside the blood. 94. Why do malaria patients lose interest in activity? Answer: loss of interest in activity happens due to extreme fatigue, weaknesses, and lack of energy caused by reduced oxygen supply and ongoing fever. 95. Can malaria affect muscle strength? Answer: yes. Malaria reduces muscle strength because oxygen and nutrients needed for muscle function are reduced due to destruction of red blood cells. 96. Why do malaria patients feel uncomfortable in hot weather? Answer: hot weather increases body temperature, stress, which worsens fever symptoms and makes dehydration and weakness more noticeable. 97. Can malaria cause sweating during the day? Answer: yes. Sweating can occur during the day, especially when fever breaks or during cycles of temperature regulation in the body. 98. Why does malaria make someone feel mentally slow? Answer: mental slowness happens due to fever, fatigue, dehydration, and reduced oxygen supply to the brain, which affects cognitive speed. 99. Can malaria affect physical strength permanently? Answer: in most cases, malaria does not cause permanent weaknesses. but repeated or severe infections can delay full recovery of strength for some time. 100. Why is malaria still common in many countries? Answer. Malaria remains common because mosquitoes breed easily in warm climates with stagnant water, and prevention methods are not always consistently used in higher risk areas. So we've gone through malaria step by step, from how it enters the body to why it causes fever, weakness, chills, and even severe complications. If there is one thing I want you to remember, it is this. Malaria is not just ordinary fever. It is a parasite inside the blood, and the earlier it is detected and treated, the safer the body becomes. If you are watching this and you often experience repeated fever, body pain, or weakness, don't assume, get tested early. And if this video helped you understand something clearly today, then make sure you don't keep it to yourself. Someone around you needs this information too. I will be continuing this series with more deep questions, myths, and hidden facts about malaria, so stay connected. Take care of your health, and I'll see you in the next live session.